Have you ever looked at your child and wondered, how can they have so many different things going on at once? Maybe they struggle with constipation and maybe they don't sleep well, they become overwhelmed by noise, they have frequent headaches, anxiety, emotional meltdowns. At first glance, all of this seems like completely separate problems, but what if they actually weren't? What if they were actually different expressions of the same underlying issue? At House of Chiropractic, this is something we see every single week. Parents often come to us believing they're dealing with 5 or 6 different problems, when in reality, there may be one common thread connecting all of them. That common thread is something called dysautonomia. Now, many people have never heard that word before, and there's a good reason. Dysautonomia is often called an invisible condition because children and adults frequently look completely healthy on the outside. Blood tests may come back normal, scans may show nothing is unusual, and yet they're clearly struggling. It's estimated around about 70 million people worldwide are affected by dysautonomia. Yet many go undiagnosed because the signs don't fit neatly into one medical specialty. One child sees a gastroenterologist, another sees an ENT, another sees a psychologist or an occupational therapist. And every practitioner is doing exactly what they've been trained to do by looking carefully at one part of the body. But sometimes nobody steps back to ask a bigger question. How well is the nervous system coordinating everything? So to understand dysautonomia, we first need to understand the autonomic nervous system. And this is the part of your nervous system working behind the scenes every second of every day. It regulates your heart rate, digestion, immunity, inflammation, hormones, sleep, movement, emotional regulation, sensory processing, and so much more. One of the easiest ways to understand it is to imagine driving your car. You've got an accelerator and a brake. Your sympathetic nervous system is the accelerator. It prepares you for action. It helps you respond to stress. Your parasympathetic nervous system is the brake. It allows your body to rest, digest, heal, and recover. In a healthy nervous system, these two systems work together beautifully. You accelerate when you need to, and then you return to calm, regulated state afterwards. But imagine driving everywhere with your foot permanently on the accelerator. The engine works harder, fuel is burned faster, parts wear out sooner. Eventually, the car simply doesn't perform as well. Our bodies work in much the same way. When the nervous system becomes stuck in stress mode, every system in the body has to work much harder just to keep up. And this is one of the reasons dysautonomia can feel so confusing. It rarely just shows up in one area. Instead, it can show up across many different body systems at the same time. And one of the biggest players in all of this is the vagus nerve. The vagus nerve is the longest cranial nerve in the body. It travels from the brainstem through the neck and connects with the heart, the lungs, the digestive system, and many other organs. Around 80% of its fibres can carry information from the body back to the brain, constantly updating the brain about what's happening throughout the body. Think of it as one of the body's greatest communication highways. When the vagus nerve is functioning well, it helps to regulate digestion, supports healthy sleep, calms inflammation, slows the heart, and helps the body recover from stress. But when the nervous system becomes overwhelmed and spends too much time in fight or flight mode, that communication becomes less efficient. Instead of moving easily between stress and recovery, the body begins living in survival mode. And this is why some children experience anxiety, emotional outbursts, disrupted sleep, digestive challenges, sensory sensitivities, poor appetite, or frequent illness, maybe even all at the same time. And while these signs may appear unrelated, they can all reflect a nervous system that's struggling to regulate. So why are we seeing dysautonomia more often? Well, here at House of Chiropractic, we often talk about something called the perfect storm. Rather than one single event causing a problem, it's usually layers of stress building up over time. Stress during pregnancy, environmental toxins, birth interventions, early illness, repeated infections, medications, ongoing emotional and physical stress. We also know that a baby's nervous system begins developing long before birth. Maternal stress hormones such as cortisol can cross the placenta and influence how a baby's nervous system learns to respond to stress. Birth itself can also place physical demands on the delicate upper neck and brainstem, particularly when interventions are required. And none of these experiences alone determine a child's future, but together they can contribute to a nervous system that finds regulation more difficult. Because the autonomic nervous system coordinates so much of the body, dysautonomia can affect almost every system. Some children experience chronic constipation, reflux or gut concerns. Others struggle with headaches, sensory processing, emotional regulation or fatigue. Some experience chronic inflammation, immune challenges or dizziness, and others may have orthostatic intolerance or POTS. This wide range of signs is exactly why families often spend years searching for answers. So if your child struggles with poor sleep, digestion, emotional regulation, anxiety, sensory challenges, recurring illness, or simply has a collection of these symptoms that just don't fit neatly together, it may be worth looking into more closely how their nervous system is functioning. At House of Chiropractic, we don't like guessing. Every family begins with our Neurological INSiGHT Scans, and these gentle, non-invasive scans allow us to objectively assess how the nervous system is functioning and adapting to stress. Rather than simply asking what's wrong, we ask how well is the nervous system actually regulating. Our NeuroPulse scan helps us understand how the autonomic nervous system is responding to stress and whether it's showing patterns such as fight or flight dominance, neurological confusion or neurological exhaustion. Combined with our neurothermal and surface EMG scans, we gain a much clearer picture of how the nervous system is communicating and adapting. Perhaps one of the most valuable part of these scans is that they actually give us a baseline. We can measure progress over time rather than relying on guesswork, helping us personalise care and track how the nervous system is responding. If you've been listening today and you're finding yourself thinking, this sounds like me or my child, or even this sounds like my family members, please know this. Dysautonomia does not mean you or your child is broken. More often than not, it means their nervous system has been carrying more stress than it has been able to adapt to. The encouraging news is that the nervous system is incredibly adaptable. When we better understand how it's functioning, we can stop chasing individual symptoms and begin supporting the system that coordinates them all. And that's exactly what we're passionate about here at House of Chiropractic. If you'd like to better understand how you or your child's nervous system is functioning, we'd love to help. Sometimes the biggest breakthrough doesn't come from doing more. It comes from finally understanding what the body has trying to tell us all along.